Step number 1 of my new series of clinical reasoning 1, 2, 3, emphasize the importance of recognizing what clinical data is relevant and what are the nursing priorities. Step number 2, identify the importance of recognizing 6 clinical relationships in order to put the clinical puzzle together. Step number 3 emphasizes the importance of caring like a nurse by emphasizing holistic care. And holistic care has 4 components that are emphasized in this case study, step number 3. Number 1, integrate caring, empathy, engagement, and presence while the nurse provides care. Number 2, the importance of caring for the entire person, physical, emotional, and spiritual. 3, identify educational and psychosocial needs and priorities. And 4, determine the psychosocial priority and plan of care. While we looked at the physical priorities in steps number 1 and 2, now we need to think globally and put this all together with the importance of psychosocial priorities. So now we know the patient's physical problem of heart failure, Joanne Smith, and her heart failure exacerbation, in acute distress, 15% EF. Now let's just look at her psychosocial history. And this is what her psychosocial history is. Joanne is a retired math teacher who is unable to maintain the level of activity she has been accustomed to because of the progression of her heart failure the past 2 years. She has struggled with depression the past 2 years and has been more withdrawn since her husband of 52 years died unexpectedly 3 months ago from a myocardial infarction. So using the same principle of clinical reasoning, what data from the social history is relevant and must be interpreted as significant by the nurse? We want our students to recognize the importance that she's lost her ability to maintain her standard of living. She's also struggling with depression. Are those 2 things related? They may or may not be, but they certainly have a likely relationship. And finally, the recognition that her husband of 52 years died suddenly, and it wasn't that long ago. And the loss of a spouse after that many years is one of the most significant psychosocial stressors a person can experience. And so that must be recognized and addressed at some point in time in the nurse's plan of care. So now let's put it all together with a series of 10 questions that are contained in step number 3. Number 1, based on your identification of relevant clinical data, is a psychosocial concern present? And as we've looked at what identifying relevance, we actually did identify that yes, there are some concerns related to her depression and the recent loss of her spouse. And if a psychosocial concern is present, what is it? Well, we need to look at aspects related to her emotional well-being. Her depression is certainly a psychosocial concern, and also the fact that she may be requiring spiritual support. You know, when someone is hopeless and depressed, that can also be a despair of the spirit. And a spiritual concern may also be present with this patient, but it will require further investigation by the nurse. As we look at question number 3, how does the psychosocial concern contribute to the primary medical problem or disease progression for this patient? This is where we need to recognize that soul and spirit and body do have relationship to one another. What happens emotionally and spiritually affects the physical. And in this context with this patient, could depression influence her physical status? The answer is absolutely. Because is she taking her medications? Is there maybe even a desire to die and is just not wanting to go there with her treatment regimen? That needs to be determined by the nurse at some point. Step number 4, or question 4. What are your psychosocial nursing priorities? When we look at the fact that, yes, we have a patient who is depressed, could she be suicidal? Do the elderly commit suicide? Absolutely. This patient is at risk, and that must be ascertained with an assessment looking at suicidal risk factors, also looking at her mood and affect, and looking at that anxiety and depression, and looking at her coping ability. These are all components the nurse must look at and address in this scenario, in addition to saving her life and doing what's needed with the ABCs that were in steps 1 and 2. Question 5. What interventions can the nurse initiate with each holistic category that is contained in this case study and address these psychosocial priorities? We look at, for example, the aspect of caring for this patient and providing comfort. The nurse must recognize the significance and importance of caring and compassion and the power of nurse presence, that when the patient matters to the nurse and that the patient feels that concern, that communicates caring, and it also enhances the therapeutic relationship. This is why caring must not be seen as just a fuzzy virtue ethic, but that is why it is so foundational to our profession. It also increases the more that the nurse has a caring comportment, the more engaged they are in the patient and their story. And we need to encourage that and intentionalize that. And that's one of the reasons I created this step, is to make that psychosocial and the importance of caring be relevant to our students. As we look at the emotional comportment, how do you develop a therapeutic relationship with Joanne? How are you going to connect with this patient? You know, the importance of therapeutic communication is a fundamental nursing skill, but it's very relevant and it must never be forgotten throughout the nursing program. This is why these case studies can be integrated throughout, but are ideally suited for the fundamental or first-year program. Look at the importance of emotional support, offering hope. How can the nurse provide hope? That's actually providing spiritual care. How can the nurse engage with this patient and their story? Presence and even the use of touch, how that can communicate caring, must be intentionalized by the nurse. What about spiritual care? This is a weakness in many nursing programs that must be integrated. How can the nurse provide spiritual care? Well, there's a simple assessment tool that is called FICA. Number one is faith or beliefs. What are the patient's spiritual beliefs? Do they consider themselves spiritual? These are simple questions the nurse can ask. I is for the importance and influence. Is faith important to you? And how has your illness or hospitalization been impacted by your personal faith? C is community. Are you connected to a faith center in the community or church? That needs to be determined. And A is addressing, what can I do for you? What support do you need? Do you need a chaplain? Do you have someone from your church that can come? The nurse must intentionalize and ask these very simple spiritual assessment questions. Question number 6. What principles of therapeutic communication will be needed to encourage dialogue between the nurse, patient, and family? And this is where you can really contextualize content. Therapeutic communication must not just be a chapter in a book. It needs to be applied. So active listening, being non-judgmental, the importance of the right environment, and having a purposeful communication with our patients and how that communicates caring, as well as encouraging that therapeutic relationship. Question number 7. What educational priorities will be needed to develop a teaching plan to limit disease progression for this patient and family? That was touched briefly in step number 1. We can kind of drill deeper here and again talk about those educational priorities related to the heart and her heart failure, as well as psychosocial education and looking at how we can help support her emotionally and if she needs additional mental health support and what that would look like in the community. Question number 8. What additional members of the healthcare team can be utilized to address psychosocial priorities with this patient? And again, look at the importance. The nurse cannot be a chaplain, but the nurse needs to be willing to go there and address spiritual priorities. But if she needs a chaplain and has deeper concerns, or has a loss of hope or suicidal, that needs to be identified and then implemented in the plan of care. Social services, maybe needing home care, etc. But look at the bigger picture of how the nurse is responsible to call in the healthcare team to put this picture all together. Question 9. What is the patient likely experiencing or feeling right now in this situation? This is where the nurse must develop and cultivate empathy and put yourself in this patient's context. She's chronically ill. Her husband of 52 years just died. She's struggling. She's losing hope. The nurse needs to really engage heart to heart, person to person, not this hierarchical nurse and the patient down here, but we're all human beings and must relate at that level and talk about that. And what are some principles that could cultivate that? And finally, question 10. What can you do to engage yourself with this patient's experience and show that they matter to you as a person? This is Dr. Patricia Benner's definition of caring, contextualized to a question that the essence of caring as a nurse is that the patient and their experience matter to the nurse. We want to encourage that and make sure that our students are not just providing excellent physical care, but that this person in the bed, this stranger, matters to them. That's also the principle of the Good Samaritan, where that stranger in the ditch mattered to the Samaritan, regardless of the ethnic divide, and he took care of him. With this case study, teach your students the importance of caring like a nurse by emphasizing the art of nursing. It's available only on my website, keithrn.com. Help your students to care more like a nurse. Get Clinical Reasoning 1, 2, 3 today.